Hi guys, welcome to episode 30, and today is the second part of rebuttal of the word iterative innovation in healthcare. Alright, so in the previous episodes, I introduced the differences in iterative innovation and how this is not the most suitable term to describe how digital transformation occurs in the healthcare industries. You must be very careful when using the terms such as progressive elaboration, iterative experimentation, iterative design, iterative testing, etc., etc. in healthcare settings when forming your various strategies and tactics. What's even worse, actually, in the situation is that the United States and now also partly in Canada, pharmaceutical firms who market new drugs to physicians all the time and provide samples and pamphlets and all that crap, it leads to physician overprescribing or suddenly change the patient's medication due to these progressive, elaborative, or whatever you call iterative innovation. Let's try this drug, doesn't work. Okay, well, try it again, doesn't work. Right? I consider it iterative. I'm sorry, Let's see. Okay, so, anyways, with the advancement speed of artificial intelligence, and this is from like even 10 years ago, knowledge, FDA has been creating new medications now in less than 1 to 2 years as compared to before, which is about 10 to 15 years. And the patent is about, research development is about 10 years. Patent, I think, is 15 years only. So then in the end, when the market is out of the product, after, all the experimental trials, they only have 5 years of patent left. But with the FDA using artificial intelligence and other pharmaceutical firms, obviously, using AI to create new medications, it leads to changes and amendments in medical legislation and laws, especially for pharmaceutical patents. So do you consider that as progressive innovation or iterative innovation? I don't think so. Because the rapid rate of developing new medications, according to the new researchers per se, healthcare professionals definitely are increasingly pushing new medications onto their patients, mostly as experimental trials, obviously. And that happened to me before too, as well, with my ADHD medication. And that was when Vyvanse just came out and gave me a really, really horrible reaction because it's a pro-drug. So what I just said do not satisfy the criteria of what meaningful healthcare is like. For those of you who watch this video, probably doctors or, strategists in healthcare, you guys should understand what meaningful healthcare is. If not, I will be describing it right now. As defined by the program like meaningful use refers to the effective, impactful use of the EMR electromedical records to improve the quality, safety, and efficiency of patient care. It involves not just adopting EMR, but also utilizing them to achieve specific measurable goals, like using KPIs related to patent, outcome, and healthcare delivery. All right, so let's move on. When you're rolling out a new software or new technology platform for physicians, the constant updating and upgrading of these technologies will not only add more work and stress to these healthcare professionals that are using these technologies. Their time spending on learning new iterative innovation. Sorry, I don't like that word. Anytime, and relearn it, have another training session. It is part of change management. Education is definitely necessary in any organization. But if you wanted progressive evaluation or, even say iterative innovation or implementation in healthcare setting, it has to be done in a certain amount of time. I personally would recommend about, I would say 18 months to a year. To 2 years, every retraining. You can also use that as like a professional development units, PDU, in project management, which doctors obviously also has to do to, obtain and maintain their license active. And so maybe this could possibly be part of the education. Okay, also, while agile or iterative processes, the number one goal here is to put out the product as soon as possible, as fast as you can. Do the best test as fast as you can and put out innovation that you think might change the world as fast as you can. I'm not satisfied to say that it doesn't happen or it cannot happen in healthcare settings. It is just not really possible because of the research and development time, as well as the clinicians, mindset stuck in with, the older technologies like writing things down instead of typing it in and all that. That put a lot of strain on the physician's well-being as well. So lastly, any software developmental implementation is usually obsolete after an average of about 48 months or 2 years, even with like SAP or SAP, anything. Therefore, most software development projects are under that time frame. Putting execution and testing is the most crucial, along with change management and the handoff to operations. This could mean that updating the educational of healthcare professionals on the changes in the technology platforms every 1.5 to 2 years, like I said. So I'm just repeating myself again because this is iterative education. Any iterative changes should be strictly a project management team's responsibility to roll out the update changes with the least disruption to the core business functions and the healthcare professionals' functions as well. I hope you enjoyed listening to my the 3 episodes on iterative innovation. Please comment and let me know if you agree or not agree, and let's have a debate and discussion on this. Thank you guys. Bye.